Welcome to the Deep Thinking podcast. The search for solutions to the obesity epidemic has led to a profound paradox. Are weight loss drugs a triumph of medical science, or do they reflect a deeper failure of modern society? If the only answer to rising obesity rates is a lifelong dependency on pharmaceuticals, what does that reveal about the systems that created the crisis in the first place? The modern world has engineered an environment where obesity is not an individual failing, but an inevitability. Food systems prioritize profits over health, urban landscapes discourage movement, and economic structures reinforce cycles of poor nutrition and stress-driven consumption. For decades, public health campaigns preached personal responsibility, urging people to eat less and move more, yet obesity rates climbed relentlessly. Then in 2023, something changed. For the first time in modern history, US obesity rates declined. The decrease was small, less than 1%, but it marked a significant departure from a decades-long trend. Some experts pointed to the rise of weight loss medications like Ozempic and Wegovy, which rewire metabolic processes to suppress appetite. Others, like Dariush Mozaffarian of Tufts University, cautioned that the decline might be a tragic statistical illusion, the result of COVID-19 mortality disproportionately affecting individuals with obesity. If the latter is true, then this so-called progress comes not from improved health, but from loss of life. Regardless of the cause, this shift has reignited debates about the role of pharmaceuticals in public health, economic justice, and personal autonomy. If obesity is increasingly managed through lifelong medication rather than prevention, what does that mean for the future of healthcare? Are weight loss drugs the beginning of a new era or just another chapter in the long history of failed obesity interventions? The rise of pharmaceutical weight loss treatments marks a pivotal moment in how modern societies address obesity, not through systemic change, but through individualized medical intervention. This shift signals more than just a new approach to weight management. It fundamentally redefines the relationship between health, autonomy, and economic structures. Instead of targeting the conditions that create obesity, societies are increasingly turning to medications that allow individuals to adapt to an unhealthy world. For decades, obesity has been framed as a personal failing, a result of poor diet, lack of exercise, or weak willpower. Public health campaigns urged people to make better choices, yet obesity rates continued to rise, suggesting that lifestyle advice alone was insufficient. This was not due to a lack of awareness or discipline, but rather because modern environments are engineered to promote weight gain. Ultra-processed foods are cheaper, more accessible, and aggressively marketed, while urban development and economic structures limit opportunities for physical activity. Stress, financial insecurity, and long working hours drive emotional eating and reliance on convenience foods. In this landscape, obesity is not an individual problem, but a systemic outcome of industrialized societies. Weight loss medications like Wegovy and Ozempic offer a biological shortcut, a way to suppress appetite and regulate metabolism in a world where traditional weight management strategies often fail. But their growing dominance raises a crucial ethical dilemma. Should medicine be used to help individuals conform to unhealthy systems, or should those systems be restructured to prevent obesity in the first place? This question is particularly urgent given the economic and political incentives behind weight loss drugs. Governments facing rising healthcare costs and declining workforce participation see these medications as a tool for economic productivity rather than a genuine health solution. In both the US and UK, discussions about expanding access to weight loss drugs often focus on reducing national healthcare expenditures, increasing employment rates, and minimizing obesity-related disability claims. The implication is clear. These drugs are not just being marketed as a way to improve health, but as a means of keeping people economically active. This shift carries profound philosophical implications. If maintaining a healthy weight becomes dependent on lifelong pharmaceutical intervention, then health itself is no longer an intrinsic human condition. It becomes something sustained through continuous medical management. This raises concerns about autonomy and medical dependency. Is an individual truly in control of their body if their ability to maintain a healthy weight is contingent on perpetual medication use? If weight loss drugs become a necessity rather than a choice, then the boundary between voluntary treatment and societal expectation begins to blur. The normalization of weight loss drugs also creates a two-tier system of health. In countries with privatized healthcare, wealthier individuals can access these drugs easily, sometimes for aesthetic weight loss rather than medical necessity. Meanwhile, lower-income individuals who are most affected by obesity face barriers to access, insurance limitations, and rationed public health programs. This reinforces existing health inequalities. Not only are poorer populations more likely to suffer from obesity, but they are also the least likely to obtain the treatments needed to manage it. The question that remains is whether weight loss drugs will be a temporary measure or a permanent fixture of modern health policy. If they are used as a bridge towards systemic reform, they may play a valuable role in alleviating suffering. But if they become a long-term substitute for addressing the root causes of obesity, then they risk turning a preventable condition into a lifelong medical dependency controlled by pharmaceutical corporations. The dominance of pharmaceutical weight loss treatments in public health policy reflects a broader shift toward medicalizing social and economic problems rather than addressing their root causes. While medications like Wegovy and Ozempic offer short-term relief for individuals struggling with obesity, they also reveal the reluctance of governments and industries to implement systemic changes that would make these drugs unnecessary. Instead of regulating ultra-processed food, restructuring urban environments to encourage physical activity, or addressing socio-economic disparities that fuel obesity, policymakers have chosen the path of pharmaceutical intervention, convenient, profitable, and politically expedient. This reliance on weight loss drugs as the primary solution to obesity raises fundamental questions about the future of health. If long-term pharmaceutical use becomes the standard method of weight management, does this mean that human biology is being reprogrammed to adapt to an inherently unhealthy world? Instead of changing the way food is produced and consumed, society is adjusting the human body itself to function within a damaging system. This shift is particularly visible in how weight loss drugs are being framed as economic necessities rather than purely medical treatments. Governments are promoting these medications not just as a way to improve individual health, but as a strategy to boost workforce participation, reduce absenteeism, and cut national healthcare costs. In the UK, discussions around expanding access to Wegovy have been tied to the rising number of individuals unable to work due to obesity-related conditions. In the US, weight loss drugs are increasingly being put at wellness programs and employer-sponsored healthcare plans, emphasizing their value as a tool for keeping workers productive rather than fundamentally improving public health. This economic framing introduces a troubling ethical dilemma. If weight loss drugs become a condition for employment or healthcare access, will individuals still have a genuine choice in whether to take them? Already, we have seen how workplace cultures incentivize pharmaceutical use for conditions like anxiety and ADHD, where employees feel pressured to medicate in order to function within demanding environments. If weight loss drugs follow the same trajectory, then the line between voluntary medical treatment and social expectation will blur. Individuals may feel compelled to take these medications not for personal well-being, but to remain employable or financially stable. The rise of weight loss drugs also deepens existing health inequalities. While wealthier individuals can access these medications freely, often through private prescriptions, lower income populations face barriers such as insurance restrictions, rationed public health programs, and the inability to afford out-of-pocket costs. This creates a two-tiered system of health where the wealthy can maintain weight through pharmaceuticals, while those who cannot afford them are left to navigate the very systems that contribute to obesity in the first place. The profit-driven nature of the pharmaceutical industry further complicates this issue. Companies producing weight loss drugs have a vested interest in keeping people on these medications indefinitely, leading to concerns about lifelong medical dependency. Unlike traditional medical treatments, which aim to cure or manage conditions with minimal intervention, weight loss drugs require continuous use to sustain their effects. If an individual stops taking them, weight regain is likely, ensuring a long-term market for pharmaceutical companies at the expense of public health solutions that could address obesity at its source. The increasing reliance on weight loss drugs represents not just a shift in medical practice, but a transformation in how societies define health and personal responsibility. Historically, public health initiatives have focused on prevention, education, and structural reforms to create environments that support long-term well-being. However, the pharmaceutical approach to obesity places the burden on individuals to manage their weight through medication rather than demanding change from the industries that profit from unhealthy food and sedentary lifestyles. If this trajectory continues, weight loss drugs could become a permanent fixture in modern life, where maintaining a healthy weight is no longer a natural biological process, but a medically managed condition sustained through pharmaceutical intervention rather than systemic change. The question is whether society will accept this as the inevitable future of health, or whether a deeper transformation is still possible. If weight loss drugs become a permanent fixture in modern healthcare, the implications will extend far beyond individual health. Their rise signals a fundamental redefinition of human biology, agency, and the role of medicine in shaping society. The reliance on pharmaceuticals to regulate body weight reflects a world where health is no longer maintained through natural processes, but through biochemical intervention, creating a future in which the body itself is modified to fit an environment that refuses to change. This shift towards pharmaceutical dependency has philosophical and ethical consequences that go beyond obesity. Medicine has traditionally been used to cure illnesses and restore health, but weight loss drugs do not heal a disease. They sustain a state of being that is otherwise unattainable within existing societal structures. This raises a deeper question. Is health becoming an artificial construct, something only through continuous medical management rather than through natural equilibrium? If so, what does that mean for autonomy, freedom, and the ability to exist outside of medical intervention? This transformation also reinforces a widening divide between those who can afford to live in a medically optimized state and those who cannot. As weight loss drugs become more widespread, they risk creating a two-tiered system where only the wealthy can access pharmaceutical weight management, while low-income individuals remain trapped in the very conditions that promote obesity. This would mirror existing health disparities, where access to high-quality medical care, nutrition, and preventative health resources is determined by socioeconomic status. Beyond economic inequality, there is also the issue of corporate control over human biology. The pharmaceutical industry, motivated by profit, has an incentive to ensure that weight loss drugs become a long-term dependency rather than a temporary intervention. Already, newer, more powerful versions of these drugs are being developed, and the trend suggests that incremental improvements will continue to be marketed as essential upgrades, ensuring an expanding consumer base rather than a decreasing need for treatment. This model of continuous pharmaceutical intervention creates a paradoxical form of dependency. Rather than empowering individuals to take control of their health, it ensures that their ability to maintain a healthy weight is perpetually linked to ongoing medical consumption. The consequences of this are profound. Unlike other medical treatments that aim to restore autonomy, such as antibiotics curing infections or vaccines preventing disease, weight loss drugs risk becoming a permanent fixture in the lives of millions, not because the body is inherently failing, but because the world has been engineered in a way that makes obesity almost inevitable. This also raises political and regulatory concerns. As weight loss drugs become more entrenched in healthcare policy, governments may face pressure to subsidize them on a large scale. While this could improve access, it also risks shifting public health priorities away from structural changes that could prevent obesity in the first place. Instead of investing in food policy reform, urban infrastructure that promotes physical activity, and educational programs about nutrition, funding could increasingly be directed toward maintaining a medicated population that remains dependent on continuous pharmaceutical treatment. The most unsettling aspect of this shift is how gradually it could become normalized. If the use of weight loss drugs becomes as routine as taking supplements or wearing corrective lenses, then the idea of managing body weight through natural means may become obsolete. Future generations may grow up in a world where the concept of maintaining a healthy weight without medication is seen as outdated, impractical, or even impossible. Despite these concerns, weight loss drugs do provide genuine benefits to individuals who struggle with obesity. For many, they represent a form of liberation from a cycle of weight gain, failed diets, and metabolic challenges. However, the way these drugs are being framed, as a mass-scale intervention rather than an individual treatment, suggests that their impact will go far beyond personal health decisions. The extent to which societies rely on these medications will shape not only the future of obesity treatment, but also how humans interact with their own bodies in an era of increasing medical intervention. At its core, this debate is not just about obesity. It is about how modern societies choose to solve large-scale health crises. If the focus remains solely on pharmaceutical solutions rather than tackling the systemic causes of obesity, then we risk moving toward a world where health is no longer something we cultivate, but something we consume, regulated, prescribed, and controlled by the industries that profit from both the problem and its solution. Thank you for listening to this episode of the Deeper Thinking podcast, an audio essay read by me, Holly, your digital narrator. Until next time.